Hello, everyone. Dr. V and Merkle here. It's great to be with you today. Got a great case update for you. This is a patient I've talked about many times on the radio, my radio program, WHIO.com, as well as when I lecture, I commonly talk about this case. There's many I could talk about, but this is a nice long-term case. She presented in 2007 with breast cancer, medically diagnosed. In her CA2729, the cancer most common marker for breast cancer, the CA2729 was 185, and you can see right here it's supposed to be less than 38. 185 tells me cancer's already metastasized, it's already spread. Came to me for a second opinion, but with cancer at that level, she was told to start taking chemo and radiation. If she did all of that, she'd have 8 to 10 years to live, which oncologists thought was pretty good. But this lady is 48, trim, thin, looks great, eats organic, is vegan, takes vitamins, exercise, looks truly awesome. And now the doctor said, you got 8, 10 years to live, even if we do chemo radiation. Came to me for a second opinion. And I said, why don't you try it my way for 2 weeks, maybe 2 months, see what we can do. And she did. You can see where the CA2729 dropped from 185 down to 140 in 2 weeks. No medical treatment. In 3 months, is down to 35. No medical drugs, chemo, radiation, or hormone therapy. And that was in 2007. It's 2019. In fact, it's May 17th, 2019 right now. And she is doing very well. But we had a little episode in the last few months that kind of worried me about her. Now, we've tested the CA2729, and it generally stays around, the CA27 stays around 21, 22, maybe up to 23. But stays around that area the last many years. In most people, women will have something in the mid-teens, maybe low teens. If they're very young, they'll be even lower than that. But this test, which he's had done probably over 100 times in the last 10 years, runs about $40. Now, if you were to have this test done at your medical facility, medical doctor, it's going to run about $380. So would you pay out of your pocket $40 to see where you are concerning this cancer marker? But anyway, we've been testing it every several months, at least once a year, in a complete blood test. And if you will look further in science-based nutrition, my materials, you'll see what we look at, what we consider a foundational test, and then this cancer marker is part of the cancer panel. And so we've ran this many times. And in September 5th, 2018, we ran this test, and it was at 20.9. That's the lowest level in 2 years. Still, she's had no hormones, chemo, radiation for 12 years. Is that awesome? That's very good. And she has no impairment. She's great. She's about 60 years old now. But in March of this year, March 23rd, we ran another blood test, and it's up to 32.3. 12-point jump in what? A few months. In 6 months, it had jumped 12 points. That's alarming to me. Okay, I know it's below clinical, but that's going the wrong way. If it jumps another 12 points, now we've got the cancer's back, medically speaking. But I'm concerned. So I have her come in and we talk and find out that in July of 2018, a small aneurysm in the brain was found, and it was causing many seizures. So at that time, she started amlodipine, valsartan, which is valsartan, and CBD for seizures, and lisinopril for hypertension. Now, she didn't have high blood pressure. She was just put on the lisinopril to lower blood pressure more, to help take pressure off the aneurysm. I assume that was her thoughts. Now, so she'd been on those meds since July of 2018. Now, we tested her in September, so she was only on those meds about 2 months before we tested her blood in September. Understand the dates there? July, she started the meds. In September of 2018, we tested her. But her number in September was good at 20.9. Here we are in March. Something's wrong. What I'm thinking, what is different now than it was 6 months ago? The medication. Now, I don't know if the medication was causing this cancer marker to rise, because if you look at these meds, there's no direct link, these meds, to cancer. And I'm not saying there is, but maybe these meds affected the liver, the immune system, and was a burden to the immune system such that the immune system was distracted. Maybe the cancer started coming back. So I wrote her a letter. We talked, and I said, I don't know if the meds are causing it, but I'd recommend you do a little experiment. Either stop the meds, reduce the meds, talk to your medical doctor, see what you can do about modifying the meds for a few weeks, and then go on a program, tighten up your diet, go on the cancer protocol vitamins that we have to get your body's immune system stronger, and then test that number again and see what happens. Well, so we got the numbers back in May 11th, on May 11th. Now remember, today's May 17th. So on May 11th, we did a blood test again, the CA2729, and the number was 26.4. Yes! It dropped 6 points. That is awesome. The main thing, it didn't go higher. Wow, it came down 6 points. We keep working on that, and it'll probably get back down to the 20 that it was before. Now, I gave her those instructions, but I didn't know what she had done. She emails me, sends me a note that she had stopped all the medications because of potential problems that she was having. So, wow, hallelujah. It's great, exciting that the numbers came down quickly. And we know that that combination of medications may not be good for her as far as her immune system fighting cancer. So what do we do about the aneurysm? Potential seizures. We'll have to see what happens on that. We'll keep you posted. But right now, great time of celebration. This lady's doing fine. She has not been on the meds now for several months, since March. This is May, and she's had no seizures and no problems. I'm not saying she won't, but as of right now, she's doing great. So celebrate. If you're having health problems, maybe you've got cancer or some other problem like that, maybe there's a natural solution, a simple, safe, natural solution. And what I recommend to everybody, I don't have a cure for cancer. I don't have a cure for cancer. Our goal is to get you healthy. If your body can get healthier, is it possible that your body can do what it already knows how to do? And that is, it already knows how to fight cancer. So if you need some help, you'd like a second opinion, you'd like to maybe try a natural, safe, natural option, contact us at the information below on your screen, and maybe we can help you, and maybe we'll be talking about you on one of these cases as well. If you have problems, you're welcome to be a patient at my office here in Dayton, Ohio, Take Two Healthcare. We do take care of patients long distance, or maybe we can find a doctor that I've trained who's in your area too. So have a great day, celebrate, and like I say every Saturday on my radio show, do something today to be healthier than you were yesterday. I'm Dr. Merkle.